Hello and welcome to a deep dive.
Hello.
We've got, well, quite a stack of sources here today,
We do indeed.
all focusing on some really significant public health changes coming up in the UK in 2025.
Yeah, big stuff.
So our mission, as always, is to kind of unpack this material together, dig into it, and pull out the key takeaways for you.
Let's get started. What these documents really show is a clear strategic push
Towards what exactly?
towards preventive health mainly, and
Yeah.
also strengthening the public health infrastructure itself.
Absolutely. And the first sort of major area that really jumped out from all these sources is the big shakeup around tobacco and vaping.
Yes,
At the core, you've got the Tobacco and Vapes Bill, and its aim is, well, it's pretty bold.
it really is.
Creating a smoke-free generation by stopping tobacco sales to anyone born on or after January 1st, 2009.
Yeah, this isn't just tinkering around the edges, is it? The material suggests it's a fundamental policy shift.
How?
Well, the idea is to stop a whole future generation from ever legally buying cigarettes.
Yeah.
Tackling it right at the source.
Right. And it's not just tobacco. The sources also detail stricter rules for vaping.
Definitely. Especially the ban on disposable vapes. That's coming in June 1st, 2025.
And one paper we looked at specifically mentioned the surge in youth vaping rates.
Exactly. That seems to be a key driver for that specific ban, according to the sources. It's addressing health and environmental concerns there.
That makes sense. The sources also talk about expanding smoke-free zones.
Yes, places like playgrounds, hospital grounds.
Which seems simple, but the argument in the material is that it helps sort of normalize not smoking in public.
Especially around children or vulnerable people. It subtly reinforces that it's not socially acceptable in those shared spaces. It's about changing norms.
Okay, so shifting gears a bit, the sources also give a lot of attention to enhanced disease surveillance.
Yes, that's another major pillar of the 2025 changes.
Starting April 6th, 2025, the UK Health Security Agency, they're the ones tracking health threats, is expanding its list.
Quite significantly. We saw in the material, medical professionals will need to report 8 new conditions.
Things like MERS.
MERS, yes, that serious respiratory illness, and also certain zoonotic flu strains, the ones that jump from animals.
And labs, too.
And labs have to report 10 additional pathogens. It's a broader net.
What really seemed pivotal in the sources, though, was the new electronic notification system.
Absolutely. They frame that as key because it streamlines the whole reporting process.
Getting data much faster.
Almost real time is the idea. And the sources argue that faster data means faster public health responses.
So identifying outbreaks sooner.
Exactly. Tracing contacts, rolling out interventions like testing or vaccines much more quickly than maybe was possible before. It strengthens the whole detection and response capability.
Okay. And then finally, the documents also touched on children's health, specifically within schools. The Children's Well-Being and Schools Bill.
Right. This bill, as the sources describe it, aims to integrate health and education much more closely.
Improving welfare, education standards.
The key things highlighted were weaving health education into the curriculum more strongly.
And mental health, too.
Boosting mental health awareness and support in schools, definitely. Also ensuring access to nutritious meals and really emphasizing physical activity again.
And the long-term impact, one analysis suggested.
Well, the potential is substantial, according to that analysis. Instilling healthy habits early on.
Which could reduce chronic diseases later.
Precisely. And mental health issues, too. It's about empowering young people, giving them the knowledge and environment to make healthier choices for themselves down the line.
It's clear these policies, from smoking prevention to disease tracking and school health, they're all aiming for a healthier population.
They are. But the sources also acknowledge the challenges.
Like making sure people actually comply.
Compliance, yeah. And tackling misinformation, which is always tricky. Plus, ensuring there are enough resources for enforcement. These are flagged as real hurdles.
And public engagement seems key.
Crucial. The material really stressed transparent communication, explaining why changes are needed, and involving communities, running educational campaigns on the benefits. That buy-in is vital.
So, to recap for everyone listening, we've looked at these ambitious new tobacco and vaping rules, the strengthened disease surveillance system, and this focus on children's well-being via schools. Understanding these shifts is pretty key, isn't it?
It really is if you want to stay informed about the public health landscape here in the UK as 2025 unfolds.
It's quite a lot happening.
It is. And what's fascinating looking at the sources is how these different policies, tobacco, surveillance, schools, seem interconnected. They're presented as pieces of a larger strategy for a healthier future.
Which brings us to a final thought.
Yes. Given the scope of these government-led changes we've discussed from the material, it does raise an interesting question for you, the listener, to think about. What role do you believe individual responsibility plays alongside these kinds of sweeping government policies in actually creating a healthier society?
That's a really important question to ponder. Thank you for helping us dig through all this today.
My pleasure.
We hope you found this deep dive insightful. Until next time, stay informed and take care.